Step into office hours with Dr. Diana Ramos, a series that highlights innovations in maternal health in California. Hosted by the California Surgeon General, these conversations tackle technology, equity, and successes with industry leaders. We dive deep into the topics that matter most to Californians and their community. Whether you're a health professional, an advocate, or simply passionate about well-being, these episodes deliver insights that inform, empower, and inspire. Tune in and join the movement toward a healthier California. On this episode of Office Hours with the California Surgeon General, Dr. Diana E. Ramos sits down with Susanna Visuri Monacelli to discuss innovation in maternal health.
Hello, I'm Dr. Diana Ramos, California Surgeon General, and today we're talking about maternal health, one of the most important indicators of how well our healthcare system serves women, families, and communities. California has made meaningful progress. Pregnancy-related maternal mortality has declined from the high of 21.6 deaths per 100,000 live births in 2021 during the pandemic to a current 15 in 2022. But we still have a ways to go to get to our low of 9 per 100,000. Now, we know preventable complications of maternal mortality still occur. Cardiovascular disease remains a leading cause of maternal death, and Black women in California continue to face disproportionately high risks, and too often, warning signs are missed before a crisis unfolds. So the question before us is this: how do we move from reactive care to predictive care? Today, I'm honored to welcome a global leader in connected health innovation, Susanna Visuri Monacelli. Susa leads enterprise growth and care model innovation at Philips, serving as head of strategy and business development for connected care and head of ambulatory virtual care. She brings over 2 decades of leadership across payers, providers, life sciences, and digital health, and has scaled remote monitoring and FDA-cleared innovations across 18 countries. Wow, so impressive. Susa, welcome.
Thank you so much. Happy to be here.
All right, let's get started. California has made important strides in maternal health, yet preventable complications still occur. From your perspective, where are the greatest opportunities to improve outcomes right now?
I love this question because it starts to combine two things that I'm incredibly passionate and have been very passionate about in my life. The first is that I think prevention is one of the biggest opportunities we have. We know that about 87% of pregnancy-related deaths are preventable. And so when I think about what underpins that prevention, it's data. And it's such an interesting opportunity for us to think about not just consumer devices, but clinical grade devices, and how this information starts to come together to really, as you said, start to create predictability. And that's one of the things that at Philips, we feel really, really passionate about, both in our maternity program and how we collect information through just everyday connected devices. We like cellular devices, which we'll talk about a little bit later, but it allows you to create that data and those signals that in and of themselves may not mean as much, but when you start to look at them at a population level, you can start to see those predictive trends. So that's one half of it. The other is that I really feel that postpartum is a blind spot for us. We know that globally, 71% of pregnancy-related deaths occur postpartum, and in California, I understand that it's 62%. And that's still within that first year after pregnancy. And so this really speaks to the ability of how can we monitor people in vulnerable communities or rural areas where we may not have all the resources. And again, I feel like technology has an opportunity to make care more accessible and more affordable. So I look forward to expanding on those two things, but that's really where I feel like there's so much opportunity and work to be done. And it's not something that we don't do today. It's something that we have an opportunity to scale today.
So thank you for that call out and those statistics, Susa. Are we missing the warning signs, or Are our systems failing? What's happening that clinicians are not seeing the opportunities? Why is this the right moment for deeper collaboration then between public health leadership and technology innovators like Philips?
I feel like I love looking at this question from the perspective of how do we start with a common goal? Because I feel like both public health leaders and technology innovators like Philips really seek to achieve the same goal, which is reducing maternal mortality and morbidity. Now, we approach it slightly differently. The way that we think about kind of technology users, we tend to be in our own silos, often solving things from a product perspective, perhaps. But to achieve that scalability, creating a closer collaboration with our public health leaders enables us to take this technology and really bring it forward to our communities together. And I think that that's where the alignment starts to strike us. We feel also that there's so much that can be done as AI enabled early warning signals and systems become more available. Philips is really taking this more kind of an intelligent health systems approach and thinking about how could we use AI to help take the strain off of the workforce, as well as help address some of those maternity care deserts that we see out in the market.
Those are really great call outs because we have to break down the silos and really include the voices of the people that we're trying to help in the development and implementation of all of our efforts. Yes, you make very good points. So, how has maternal and fetal monitoring evolved in recent years, and what advances are most impactful for clinicians at the bedside? I can remember training as a resident in obstetrics and gynecology and using fetal monitoring when it was really in its infancy. I have no doubt that there's a lot of new advances and innovation. Can you share?
Absolutely. So I'm going to divide it into kind of three different categories. There's this really big turn from episodic to continuous data that's really becoming a huge enabler. The second is thinking about mobility and safety. And then the third is this idea of really integrated decision support. And so I'll start with the first one, which is really thinking about the idea that we've really gone from going to the doctor, seeing the doctor, getting that episodic data right then and there, to being able to follow our patients more continuously, whether they're in the hospital environment or in the home environment. And this obviously comes through wearable devices. And so that's a huge addition in terms of decisions that can be made and how we can leverage real-time monitoring, not just in the hospital, but also in the home environment. And with that, we build that second stage, which is those predictive insights that we were talking about. What if we can predict a hypertensive mother having a care escalation because we're able to monitor her remotely and help her get the care that she needs when she needs it, and give her the support, the emotional support. That's a really big part of this journey, that when we're doing remote care, where we can influence and say, no, this is really a moment where you need to go to the hospital. We know you've got younger kids at home. We know you have responsibilities, but it's important for you as a mom to take care of yourself. We've had many of these conversations in our maternity program, and I can tell you they can make a huge difference with our patients. The second piece of it, which is tied to it, is this idea of how do we kind of create the mobility and the safety factor around our patients. The idea of being able to walk around a hospital, for example, and be mobile and be monitored within the hospital environment without being tethered, for example, to machines. These are innovations that are really making a big difference, even within the walls of the hospital. And so when we think about the more holistic approach that we can take, where you can have not just monitoring from a device-centric view, but monitoring from a whole person view, whether it's a cardiac monitor, whether it's looking at your blood pressure, whether it's looking at your oxygen levels, the more that we make these seamless, like for now, we're seeing cameras that can take vital signs emerging and video monitoring within the hospital environment. These are all things that can help prevent and create fewer C-sections, for example, can help identify patients who might be getting into distress earlier. And again, it leans on those algorithms that we talked about before.
Yes, data is so critically important, whether it's remote or whether it actually is in person. And California is recognizes and appreciates the importance of that. So we're implementing a data exchange framework to help people once they are outside of the hospital, once they're back in the community. The data exchange framework really helps align Medi-Cal's transformation initiative to improve maternal quality, collaborative community support, prevention incentives, all of these things to help support moms outside of the hospital, outside of the healthcare setting. So all of this data to be able to support moms is so critically important. Along continuing with the data theme, can you explain how real-time data and predictive tools help identify risk earlier before complications escalate when people are outside of the healthcare setting, maybe even early on?
Yeah, and we talked a little bit about kind of the care providers and the opportunity that we have in terms of making things easier. And I think that exactly as you were expanding on the data piece, this isn't just about the moms, it's about the babies, and it is about the caregiver community that exists around them, from the providers to family members, and how we can use information to engage them at the right stages of care. And so one of the things that really resonates with me on the data side is that we have these multi-parameter devices now that can collect a lot of data. But what's even better about it is that it gives a physician, when you are visiting a physician or you're visiting a healthcare provider, it gives them longitudinal context to the conversation. And that's something that you can really take a lot of data and contextualize it. So it's not just noise. And you can then start to be much more proactive instead of reactive to the patients. So you think of catching hypertension early, for example, with the patient, and helping them manage it through their pregnancy. We know that that reduces escalations that are often associated with pregnancy, and that includes ICU stays and readmissions. And so I love to believe that as we bring this data forward, it makes it easier for clinicians to play that proactive role because they can see the patient from a longitudinal view. And I think that becomes very real. And it's the same for the baby. So when we think of fetal monitoring, for example, we've made such huge advances in that area in the past years, not just in creating the signals, but slowly and thoughtfully and with clinical data, taking those signals and fine-tuning the devices to being easier and more comfortable to wear, so that it makes it, again, facilitates that entire monitoring ecosystem, and then brings those data signals together from the mom and the baby so that the clinicians can make better decisions more quickly.
Yes, that is so critically important. And we really need to understand the connectedness. So what does a truly connected maternal system look like from hospital admission through postpartum recovery and beyond?
Mm. No, I used to start by talking about the technology, but I'd love to start by talking about the person, because it is very individual. And what you do want to do is identify the patients who are that are at higher risk or need more support through their pregnancy journey. So not all solutions fit all people. And one of the things that technology is allowing us to do is make it easier to be able to fit the kind of monitoring and the kind of support that we provide our patients, and the type of data that we need to collect for our care providers to make informed decisions, fit the scenario that the patient is in. And what I mean by that is that there are some patients, as you mentioned, they come into the hospital and they get treated and they don't need continuous monitoring. But then there are other patients who come in and we want to be able to send them home. We don't want to necessarily keep them in the hospital. But if we can monitor them in the home care setting safely, then obviously that idea of being able to monitor someone from home to hospital to home to back to the hospital, that kind of remote monitoring is really, really important. The other thing is that when we think about the ecosystem of care providers that surround the patient, that's often very tailored to the patient as well. And I really believe that in a connected system, when you think about bringing those clinical signals in and combining that with electronic medical record information, you can also create a communication, a connected communication between the OBGYNs, the nurses, the midwives, the doulas, the mental health resources, and other local resources, and make that be much more of a wraparound experience around the patient. So you're almost starting to approach really precision care because you're able to personalize it in a way and use algorithms to predict the risk, and then use these same connected system tools to enable the facilitation or the care orchestration around the patient. And I think that that's where the true innovation is starting to really come.
I love the fact that you started with the person, with the patient, and you could have easily gone into the tech as the primary area of focus. And this is something that California really strives for, is having patient-centered quality care available for all Californians. Now, how do we ensure that innovation aligns with California's equity goals and reaches safety net hospitals as well as underserved communities? And this is becoming a lot harder with the closure of hospitals throughout California and the rest of the country. We are not unique and immune to that. How can we leverage, though, innovation to ensure equity and improve our outcomes?
I think it starts with what you just said, which is that everyone deserves access to high quality care. Full stop. And if we start from that premise and we think about how do we then start to solve for things differently, because we understand that we have a similar goal, but depending on the context, how we achieve that goal looks very different. So we know we have maternity deserts, we know that we have access to care barriers. Those are when we start to design to specifically address those issues, and I'll talk in a moment about how we can do that. That is one of the most important solutions that we can bring technology to bear on that, and that is a great place for Philips and for other tech companies like ours to be able to partner with the healthcare ecosystem more broadly. The second is that you want to make sure that you also have cultural alignment. When you think about coaching and supporting patients and the language support that you need, that can be a huge barrier and an intimidation factor if we don't have that thoughtful consideration around that. And we've seen that when we treat patients from Georgia to California to New York, there's such myriad of cultures and languages. I would bet that it goes beyond 52 languages that the hospital in Portland, Maine supports 52 different languages. I can only imagine when we start to look at it across the United States how many those are. But if we just focus on California itself, even that can be a huge barrier. So knowing that we can use technology and translation tools to make this care much more easily accessible, I think that's a big piece. And then I do believe that embedding the solutions in programs like Medi-Cal and managed care programs, and enabling there to be consistency between patients who roll on and off of private and public care, that information transfer is also really, really important. And again, a place where technology and these connected healthcare systems can play a really, really meaningful role. So I want to go back to the very first thing that I said on designing for maternity deserts and access barriers. One of the things that when I was leading Propeller Health, which was in the COPD and asthma space, where I also had maternity patients, one of the things that I realized is that cellular connectivity in our solutions is really important, and it's becoming more and more commonplace. It takes away some of the cost burden and the challenges with Bluetooth technology, and it enables us to make it easier for patients just to take their blood pressure or use a connected weight scale or use another type of monitor. You can kind of name many of them, but creating that simple step, then it's up to the person's preference whether they need an app. But the minute the providers can get that data signal from the patients, it adds to that entire ecosystem of caregivers that can be tapped in remotely and really support serving underserved communities. And that to me is really exciting to see. So that's just one very simple example, but it can really create a much better access point for patients.
That's very exciting, especially in the era that we live now. People want things immediately, and to be able to get the support needed, especially if elevated vital sign is shared with a provider. So critically important to know sooner rather than later, you need to come in, get care versus not knowing and getting the support that is needed. Thank you for really working on that effort to eliminate the disparities and improve the equity.
I would love to insert a story of a patient that we had, and this is one that's symbolic of many of these types of stories within our maternity program. But it really warmed my heart how it all comes together. So we use remote blood pressure cuffs, for example, to monitor our hypertensive high-risk patients. And we have a 24-hour center that monitors the data signals coming from all over the place, but looking for any abnormalities. And we had a patient, it was 10:30 at night, and she wasn't feeling well, and her husband helped her take her blood pressure. And our nurse was alerted that that the blood pressure was unusually high. And she got in contact with them. And this wonderful woman had thought, I'll just rest and I'll just go in the morning. And the nurse talked to her, and she ended up going in, and she was at high risk, and she ended up delivering the baby that night as a result, so that mom and baby were safe and no NICU hours were required. And it all ended up in a much better place. But it's a way of showing how in this rural community where care was not easily accessible, it's easy to make that choice to want to wait. And having that extra support and medical advice available to you remotely can just make all the difference in the world.
That's wonderful to hear how technology really can be that bridge to improve quality of care and saving lives, especially. So if we looked 5 to 10 years ahead, what could maternal care in California and globally look like if partnerships like this reach their full potential, pulling in technology, pulling in government agencies? How can private-public partnerships really push the needle on innovation and positive outcomes?
Yeah, I'll keep this answer kind of short because I feel like we've captured so much of it, but it's not that we're going to be breaking through in a magical way. I think that it is about scaling and improving on the things that we now have seedlings of. So when we think of predictive maternal care, if I say predictive maternal care powered by AI and longitudinal monitoring, that captures a big part of the conversation we've been having. But taking that to scale, we know we have predictive algorithms today. We know we're capable of doing longitudinal monitoring, but it is about partnering together, the private and the public sectors, to bring this technology and making it easily accessible and also affordable. Our public systems are strained. We know that. And so with that comes that technology aspect where we can bring this technology forward. And we know that because we're using this technology, just like the story I just shared with you, we can actually create cost savings in the system as well. And the second for me is postpartum remote monitoring, that it becomes a standard of care for statewide. I think that would make a huge difference in the next 5 to 10 years ahead if we really start to look at our patients, not just during that pregnancy, but really the postpartum remote monitoring post-pregnancy. And the last that I'd say is that I am very passionate and deeply passionate about cardiovascular prevention. And I believe that not only taking cardiovascular prevention really seriously pre and during pregnancy and in the postpartum, they really can have the opportunity to change the lifetime trajectory of these patients post having the baby. And so, for me, those are probably the three things that shine the most in our conversation.
That is so inspirational. That fourth trimester is a critical time because that's when, like you said from the beginning, that's when most of our moms are dying. And that's when we have to really be using technology, using our communities to support moms and to be the eyes and the ears on the ground to direct them to care when they need. Thank you for that insight. So I want to close out with a couple of questions that I ask everyone. And the first one is, what does health and well-being mean to you personally?
I wrote my undergraduate paper on what can the US healthcare system learn from the Finnish healthcare system. And the core of it was predict and prevent. And that was a few decades ago when I wrote that paper, but it became kind of the steward of my mission and why I want to be in healthcare above anything else. And I feel that especially when I look at maternal health and challenges as a mom, I believe there's so much more that we can do. And I just feel like technology enables it to be less expensive to do studies that are very specific to women. We can collect vast more amounts of data and digest it much more quickly as we continue to go into the future. And so I really believe being on this edge of technology and AI is a very important milestone for me personally, because I feel like it unlocks a whole new world of possibilities for us. And then the last is that I spent a few years living in rural California, and now I live back in California again, and I have two daughters. And I will take healthcare incredibly deeply and personally on a personal level, especially maternal health with two girls. And so that's something that speaks to me. So that is why I this means so much. And I really am very passionate about the opportunity that we have in California to continue to accelerate to our goals in saving lives.
That's beautiful. Thank you. That personal commitment really makes the why so much more powerful. And the final question is, what's one innovative idea to improve health in California? You shared a lot, but what would be one?
I think that we've seen this a lot in the news lately. And, there's many things that we could go down the path of getting more tech out there and more monitoring out there. And I think we could also talk about creating a statewide, more kind of equity-centered maternal health infrastructure that can shift the care to prediction and prevention, exactly what you're doing in terms of data sharing capabilities, and really embedding kind of remote monitoring both pre and post partum. But I think the thing that really, to me, sits at the core is the center of where are people getting their truth. And I think one more pillar to the two that I just mentioned is this idea of, could we make evidence-based maternal health literacy something that goes beyond what people are today getting from social media or AI chatbots, but to know that we're delivering meaningful, relevant clinical information, correct information, making that information more accessible from trusted sources, and utilizing technology to disseminate it even on that level. Because at the end of the day, the patient is at the center of everything. And if we can engage the patient and we can engage their communities that support them around them, I think that's an equal part. So I feel like we have very lofty goals and miles to go, but that would be something different and maybe a little bit more innovative to share in terms of this connected healthcare system that we're talking about.
Thank you so much again, Susa, for joining us and all of you for listening to this wonderful insight on how technology, public health, and really maternal health are working together with the voices of every Californian guiding our direction in improving the health of moms, babies, and families.
Thank you, Dr. Ramos.
Thank you.